Hello everyone, Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh. So we are from small group discussion B5. We'll present our student project with title Fistula Umbilical. Next. Okay, this is our member group and the presentation will be continued by my friend. Enjoy the presentation.
Hello, my name is Niputrita Risanidewi. My ID number is 2002-511138, and I will explain about the background information. Our body consists of a collection of parts that work together to achieve various optimal body functions, such as survival, growth, reproduction, and other functions. However, due to various factors, sometimes there is an abnormal structure in an organ related to other organs that causes disruption of the normal function of the body. There can be an abnormal connection between one body part and another, called fistula, which can involve organs, blood vessels, and other structures. Fistulas may occur in various parts of the body, including an abnormal connection that connects the intestine and the umbilicus, called an umbilical fistula. One of the most common pathways that may lead to the formation of this fistula is congenital. Umbilical fistula that is not detected and treated properly can cause serious complications, such as sepsis, which can cause a decrease in blood pressure, organ damage, and even death. That's all about the background information. Thank you.
Hello, my name is Bagus Saputra Renugraha with student number of 20025111219. So I'll explain about the problem formulation of the student project. So the first one is what is the definition of umbilical fistula? What is the pathophysiology of umbilical fistula? What is the etiology of umbilical fistula? How is the epidemiology of umbilical fistula? How to diagnose umbilical fistula? And how to treat patients with umbilical fistula? And for the objective is to know about the definition, the pathophysiology, the etiology, the epidemiology, how to diagnose, how to treat patient with umbilical fistula. And for the benefits is that this student project for each of us as a medical student are enormous, including the knowledge about umbilical fistula, including the definition, etiology, epidemiology, and its relation to the medical studies such as its pathophysiology, diagnosis, and therapy.
Okay, so first let me introduce myself. My name is Sidogun Setiapratnyani with 3-digit identity number 044. So now we're moving on into the definition of fistula umbilical. The background of fistula is a disorder that occurs in the connection of tissue between blood vessel, intestine, organ, and other structure. This disease generally occurs due to injury, surgery, infection, or inflammation. Fistula disease can occur in many parts of the body, including the umbilical part. Umbilical fistula, or also can be referred as vitelline fistula, is a state where the vitellinous duct is completely maintained so that a direct connection between the belly navel and the digestive tract is formed.
Greetings to our evaluator. Introduce, my name is Dave Kasapamantu with 3 last digit of student number 107. I will continue the presentation and I will talk about the anatomy. The umbilical cord or navel is a small cavity in the abdomen where it points to the attachment at the umbilical cord. Umbilical cord is a cord with a soft tortuous appearance and an amnion smooth covering. It is known to be the mother of fetus physical and emotional attachment. The length varies from 50 to 60 cm with a 1 cm diameter. It is composed of Wharton's jelly, a ground of substance that is gelatinous, and mucopolysaccharides. There are 2 arteries and 1 vein that vascularize the umbilical cord, which also urachus. Now my friend will continue the presentation. Thank you.
Hello, my name is Amanda Reza Surananda with a student number of 2002-511-337. So during the development in early pregnancy, the embryonic disc is attached anteriorly to the yolk sac, and when it grows, it has a folding appearance. Primitive alimentary canal attached to the extracoelomic portion of the vitelline duct, and the body stalks overgrown by allantois buds. Eventually, the body stalk and the yolk sac fuse to form umbilical cord. Continuing, when the abdominal wall is formed, The umbilical cord narrows, and the yolk sac and umbilical vessel, yolk canal, and allantois should be absent. Surgical intervention is needed to remove debris of the residual tissue, and during the observation of fistula or a sinus, all structure must be identified, and the ophthalmocentric or branches or fistula must be dissected back to the ileum or bladder. When the fetus is born, the umbilicus and its embryologic attachments have an anatomic relationship, such as in the picture in PowerPoint.
Hello, my name is Imadi Nanta, and my student identification number is 20025111071, and today I would like to talk about the pathophysiology of umbilical fistula. So umbilical fistulas can be caused by several mechanisms. Some of the most common ones include metal diverticulum and can also be related to the urachus. Metal diverticulum happens when the umbilicomesenteric duct fails to disintegrate. It then causes the umbilicomesenteric duct to persist and may cause several abnormalities, one of which is the umbilical fistula. When the duct persists and secures a patency along the entire tract, it is called congenital umbilicoileal fistula. Another abnormality leading to umbilical fistula is of urachal origin. The urachus, which is a remnant of the allantois, normally obliterates during fetal life. In some cases, the urachus underwent an incomplete obliteration, or might also reopen due to pathological conditions, which means it is acquired. Some case reports also showed that this condition can manifest as an umbilical fistula. Generally speaking, intestinal fistulas can also be caused by several factors, such as complication of surgical procedures, malignancy, radiation, and abscess.
Hello, my name is William Ascender Hersenso with my student ID number 011, and I would like to explain about the etiology of umbilical fistula. Umbilical fistula is a congenital condition which the connection between the gut and umbilical remains intact with each other. During the prenatal phase, umbilical has a crucial and important role in providing the connections among the fetus and the mother. Embryogenesis that has entered its sixth week, the umbilical cord becomes the site where the midgut elongates and herniates too. Furthermore, the superior mesenteric artery becomes the central point where the midgut rotates 90 degrees with anti-clockwise directions. That is located within the umbilical cord. Around this space, jejunum and ileum is formed by the elongations of midgut, followed by the closings of the vitelline duct. Embryogenesis that has entered its 10 weeks term is followed by the returns of midgut to the abdominal cavity and the disintegrations and absorptions of vitelline duct that previously had become a thin fibrous band. During this phase, if the vitelline ducts fail to fully shrink and disintegrate, it will carry on with its growth, therefore creating an abnormal conditions of fistula between gut and umbilical. Next.
Hello, my name is Rizky Purba and my student ID number is 200251158. I would like to explain about the epidemiology of umbilical fistula. So, the failure of the duct to close after birth can cause several anomalies such as mecal diverticulum, sinus duct, cyst, umbilical mucosa polyp, and vitelline fistula, or also can be referred as umbilical fistula that located centrally within the umbilical area. The overall rate of umbilical fistula abnormalities is 1 in 15,000 live births, with umbilical fistula being the least frequent.
Hello, my name is Jeffrey Nevianto with student ID number is 091. I will continue about the diagnosis. So the first step, we should do history taking. We can ask the patient, is there any pain around the umbilicus or abnormalities around the umbilicus by the patient? And then we should perform physical examination. We can see by inspection there will be a mucosal prolapse through the umbilical sinus or umbilical stump. Or maybe there's a granuloma around the umbilicus or inflammation around the umbilicus. After that, we do radiology. USG and visuography will demonstrate an abnormal communication between the umbilicus and the intestine. Okay, next.
Okay, I will continue the presentation. My name is Dipotalansi Wahydiantara with my student number is 2002-51173. In this session, I will explain about the management of fistula umbilical. Okay, management for fistula depends on the type of fistula, its cause, and how severe it is. But usually, the management is surgery combined with antibiotic therapy. The operation is performed as a drainage of pus in the fistula so that the pus can come out without forming an abscess. And fistulotomy and fistulectomy are surgical procedures commonly used in fistula cases. After the surgical procedure, the patient will be given antibiotic such as ceftriaxone to prevent infection after surgery. And this is the picture of fistulectomy and fistulectomy procedure. Okay, and next.
Hello, my name is Kada Bawa, and my student ID number 2005111-032. I would like to explain the conclusion of this paper. Umbilical fistula or fistula vitelline is a condition when the vital tract is perfectly awake so that a direct connection is formed between the belly button and the digestive tract. One of the most common pathway that may give rise to umbilical fistula is a congenital one, such as Meckel diverticulum. During the prenatal fase, umbilical cord has a crucial and important role in providing the connection among the fetus and the mother. Sign of fistula umbilical can be seen by plain eyes as a mucosal prolapse of the umbilical sinus, umbilical stump, granuloma, or other inflammation symptom around the umbilicus. Management for fistula depends on the type of fistula it causes and how severe it is. But commonly, the management is surgery combined with antibiotic therapy. That's all from me. Thank you.
Okay, thank you, Sadam, for the conclusion. And this is our reference to arrange the student project. Next. Okay, that's all from us. Thank you for your attention, and I will close this presentation with Om Santi 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 Om. Waalaikumsalam warahmatullahi wabarakatuh. Bye-bye.